My name is Dr. Robert Morea. I've been a physical therapist for 15 years, specializing in orthopedic physical therapy and chronic pain. I would describe the cause of chronic pain as an elevated resting tension level. A resting tension level is the tension in your body when you're not doing anything, when you're at rest. This resting tension level, many people don't realize is the cause of their chronic pain. It can be an radiating pain down their leg. It can be a localized pain in their back. It can be multiple pains throughout their body. Fibromyalgia, RSD, complex regional pain syndrome, lower back pain, neck pain. All of these things can be classified as chronic pain. The thing with chronic pain is that most of these people have been given a structure that they believe is the cause of their pain. But structures heal. Ligaments, tendons, muscles, they heal. It takes about 6 to 8 weeks for the most part. But if you're having pain that's lasting 3 months, 10 years, 20 years, your entire life, well, it's beyond the structure. It's your resting tension level that's elevated. If you have more tension, you're going to have more pain. As your tension level rises, you're going to have more pain. But how do you affect the tension in your body? You might be thinking, stress causes tension, and I can't do anything about the stress in my life. Well, you don't have to do anything about the stress in your life. All you have to do is change how your body's reacting to that stress. Change the tension level in your body. Now, if you have a resting tension level here, and you have a pain threshold that's here, and you're even at rest without any activity, it's above that pain threshold, well, you're feeling pain all the time. But say you have pain, your pain threshold is here, and you wake up and you're doing activities during the day, and it doesn't take too much. After maybe an hour or two, you reach that pain threshold because the tension in your body has gone up and surpassed this pain threshold, so that you have chronic pain. And then maybe you rest or you sit down, and then it goes back down and you don't feel it so much. But then you have some stressful phone call or other activities in your life, and it goes back up and you're feeling pain again. Well, the idea is to not have this tension level so close to where your pain threshold is. And there's a simple technique. It takes 45 seconds to do, and if you do it 25 times a day for 3 weeks, it'll reduce your pain threshold, it'll reduce your resting tension level all the way down. That technique is called reflexercise. And what it does is it changes the habit in your body from one of tension to one of relaxation. You might think, well, meditation and yoga do that too. Yes, but that's 1 hour a day compared to 14 hours you're awake, adding to that tension level. That's not a good fight. So you need something that will reduce it and create a new habit. You see, reflexercise creates a new habit where it uses the same part of your brain that you use to learn to walk, to ride a bike, and various other skills. You don't have to think about these things anymore. They became second nature. Well, reflexercise is making it second nature in your body to not have a tension level here, but to bring that tension level down and have it over here, real low. So that way, when you're doing your activities throughout the day, it doesn't ever reach this pain threshold. And then you go back to bed and you sleep and rest or sit in a chair and it goes back down. And you have more activity and it comes up, but it never reaches this pain threshold. So what happens? You never feel pain. That's how it works. You might think, sleep. Well, I feel pretty relaxed when I'm sleeping. That's true, but it's not pushing your resting tension level lower. It's just bringing it each night. And if you have tension throughout the day, well, it's gradually, week after week, month after month, year after year, it's gradually making that tension level rise a little bit more, to the point where it's going to be too much tension, and you're going to reach some type of pain threshold, and you're going to start feeling your pain. You might have multiple pain thresholds. Some you feel pretty quick right when you wake up in the morning. Others you might have to do a lot of activity to feel. But either way, that pain, that tension level, if it surpasses a pain threshold, you're going to feel that pain. Now keep in mind, Reflexercise is a 45-second exercise. You do it 25, well I recommend to my patients to do it 25 times a day for 3 weeks to make it second nature in their body. After that, you have to do it maybe 3 or 5 times a day just to maintain that level. And Reflexercise is one part of a 3-level process. In the entirety, it's called Associative Awareness Technique, or AAT for short. And this whole system is geared to use multiple areas of the brain to affect that tension level and hold it down. I use it with my patients that do not respond to traditional physical therapy or any other type of treatment, but yet their pain persists. And the reason I use it is one reason alone. It works. So give it a try. It's called Reflexercise.